properly finished study model is an asset to a quality-conscious dental practice. It is useful for diagnosis, graphically presents the necessary treatment to the patient, and becomes part of the patient's permanent record. A carelessly finished model is a handicap, as it creates a less than professional image of the dentist and may cause errors in diagnosis. This presentation will show the 4 basic steps in fabricating a study model. Follow these steps correctly, and you will have a professionally finished model. The steps are trimming the cast, smoothing the anatomy, sanding the art bases, and polishing the model. Before you begin trimming the cast, some preliminary steps must be performed. The impressions for the study model will contain some incorporated air bubbles, which will appear as positive defects on the cast. These bubbles must be removed before you attempt to trim the cast. Soak the cast for 10 minutes in saturated slurry water. Damp plaster is easier to trim. You may have to trim some of the excess plaster before fitting the cast together for the first time. Now, put the cast together using the wax bite record. The use of a wax bite when trimming the cast will prevent them from shifting during the trimming process. While the casts are articulated, mark the posterior limit of the teeth on the maxillary cast. You are now ready to orient the maxillary casts based on the anatomical landmarks, mid-palatine suture or midline, and plane of occlusion. Make a cut across the back of the maxillary cast. Stand the cast on the trimmer's occlusal table and make sure the occlusals of the teeth are at a 90-degree angle or perpendicular to the table. Next, grind the base of the maxillary cast to make the occlusals of the teeth parallel to the base. Estimate whether the occlusion is parallel to the grinding wheel by placing the back of the cast against the table. Now, place the base against the table and grind the back to 90 degrees to the midline. Continue this cut until you have reached the pencil mark or the posterior limit of the teeth. Keep in mind that the symmetry of the art bases is based on the cuts you have just made in relation to the midline and the plane of occlusion. Articulate the casts and invert them, positioning the maxillary cast on the bottom. Make a reference cut on the back of the mandibular cast. Place this cut against the table and cut the base perpendicular to it. The bottom is now parallel to the maxillary plane of occlusion. Rearticulate the casts, mandibular against the table, and trim them even on their backs. Place the backs against the table and trim the total length to 70 millimeters. Divide the height into thirds between the maxillary art base, the oral anatomy, and the mandibular art base. You are now ready to trim the angles on the maxillary cast. Trim the facial angles to align with the midline. Set the angulation at 25 degrees and cut the left facial angle to within 4 millimeters of the teeth. Reset the angulation and trim the right facial angle. Now, trim the heels of the maxillary cast. Adjust the angulation to 25 degrees. Utilizing the midpoint, trim the heel symmetrically on both sides. Finally, you will cut the buccal angles. Adjust the angulation to 65 degrees. Trim the buccal angles utilizing the heel angles as indicators. The next steps will transfer the cuts from the maxillary to the mandibular cast. Rearticulate the cast and Transfer the maxillary heel angles to the mandibular. You are now ready to cut the buccal angles of the mandibular cast to 55 degrees. Adjust the angulation and trim the buccal angles utilizing the heels as indicators against the angulator. Round the front from cuspid to cuspid. You are now ready for the second step, smoothing the anatomy. With a pointed instrument such as an explorer, redefine the soft, hard tissue lying at the gingival of each tooth. Remove any positive defects on the tissue portions of the cast and smooth any carved lines. To correct voids or bubbles, use a slurry mix of plaster. The casts are ready for the third step, sanding the art bases. Use a piece of smooth plastic under the sandpaper to act as a sanding block. Articulate the casts and sand the backs and the heels as a unit. Sand the casts under running water so that the residue washes from the sandpaper. Separate the models when sanding the buccal and the facial angles. The fourth and final step is polishing the models. After they are thoroughly dry, place them in a model soap for 10 minutes. Hand rub the cast with a soft cloth under running water. Careful attention to the 4 steps, trimming, smoothing, sanding, and polishing, will produce results. When used for diagnosing, presenting a treatment plan, or keeping records, a professionally finished model will pay off for the quality-conscious dentist in today's practice.